Welcome back to our ethics training. Aside from watching video 1, you should have also reviewed participant rights as found in Idaho IDAPA code and reviewed our agency's HIPAA policy from our policy and procedure manual. The links of both are below. For this second video, we're going to be covering sections 3 through 10 of the BACB ethical code. Section 3 refers to assessment. The assessment is going to be done before the plan starts. We're going to use assessments such as the Vineland or another department-approved assessment to be able to derive eligibility and the goal areas for our treatment. Quality assessment leads to quality intervention. We're going to use the results from our assessments to be able to drive that intervention, to be able to contrive our goals and find out how to best work this plan to get optimal outcomes for our clients. A copy of that assessment should be found as part of the client's plan. As we're doing assessment, we also make sure that we take a parsimonious approach to assessing our client's deficits. Parsimony refers to an approach in ABA where we use the most simplest, most obvious, least complicated solution possible. And many times that solution goes beyond us. An example would be a client that's exhibiting behavior because they're in pain. We want to refer them to a doctor to get that checked out. And if they need a change in medication, we want to make sure that's being addressed before we begin our intervention, or that that's part of the plan that's happening in the background aside from our intervention. But so often, part of assessment is going to be identifying what are the needs that are going to be served beyond what we're doing here at Journeys. Section 4 in the Behavior Analyst Certification Board talks about the behavior intervention plan itself. Hopefully you've already seen the video of Does Your Behavior Intervention Plan Get a CAB? And seen that by definition, our plans need to be conceptually systematic. That means we're using proven methodologies. We're using evidence-based forms of intervention to be able to help our clients in this behavior change. That system, that method should be carried out throughout the intervention plan and should remain consistent throughout. 4.02 talks about involving the client and their families in our planning. It's important to remember that intervention never happens to clients and their families. It happens with them. It happens for them. Our job is to be there facilitating the intervention, but it's never something we would do without their help in planning, without their help in administering and carrying out the intervention. As we look at will this plan generalize, we need to make sure that the family has helped us come up with what are the priorities and how can that behavior be maintained once we've completed the intervention. The next one talks about individualizing the behavior plan towards the client. As we do so, we go back to, is it applied? Is it socially valid and significant for that client? What are their specific strengths? What are their specific interests? What are their individualized deficits? How can we address those? And that's always the starting point of our plans. 4.05 to 4.11 talks about a risk-benefit analysis that needs to take place as part of our intervention planning. It's critical that we acknowledge that risk is always present as part of intervention. You may be working with a child on a shoe tying goal and ask, Andy, really, what risks are present in this? But we need to remember that we are interfering in that child's life, that we are utilizing taxpayer dollars. There's always risk or potential for risk that's present in any intervention. There are some key guidelines that we have in order to mitigate the risks. One is, as an agency and as a field, we never start with a punishment procedure. We focus on reinforcement and stick with reinforcements. We use positive behavior supports to be able to teach skills and reinforce the correct skills. We need to always be vigilant of the participant rights and honoring them, especially that we're not going to isolate clients and put them on timeout, that we would never use physical or mechanical restraints, and that we're going to always treat them in courteous and respectful manner, that we're going to honor their rights to refuse if they need. We're going to also, as we're using reinforcers, be careful that our reinforcers themselves aren't harmful. We first off don't want to make the client dependent on us nor our reinforcers as part of the behavior change. We also need to avoid any harmful reinforcers. I remember an intake I did a few years ago where the guardian made me promise that I wasn't going to feed their kids Smarties and M&Ms because the previous intervention they received, their child had gained a whole bunch of weight and had to change their diet to be able to lose weight because the treatment they got was stuffing this kid full of sugar every day. We obviously wouldn't give our clients alcohol and cigarettes as reinforcers, but we need to look at what are these other reinforcers that we're giving them, and could they be harmful? Is there a risk that's present with them? We also need to know when is it appropriate that we as the interventionists could be harmful to the child or the intervention process. I don't know if you've ever had like that college roommate where you just couldn't stand the way that they talked or chewed their food and you didn't want to be with them. You have an obligation, if you just are to that point where you don't want to be with your client, tell us, we'll switch you. We don't want this to be harmful or aversive for you or your client. You may not be the right fit for that child or their family. This plan may not be the right fit for you or your skills, and that's okay. It's always better to switch than it would to create something that interfered with the efficacy of the plan. As we look to section 5.0, it covers our role as and with supervisors. An important part of our field is that we have constant training and supervision. You should be observed and supervised by your supervisor every month. You should be receiving active feedback as far as how's your intervention going. I want to personally extend an invitation to you to ask questions to your supervisor. Consult with them on how your intervention is going. Invite them to come and see your sessions. Invite them to come and actively participate in the plan and in making necessary changes. Section 6.0 in the BACB Ethical Code talks about our responsibility to the field of ABA, that we are following the scientific field and that we're helping advance it. Section 7.0 talks about our responsibility to our colleagues. First, I want you to see the link below. We have a copy of our employee behavior policy. As part of this training, our expectation is that you will reread and recommit to that you signed at hiring, of your responsibility to your clients and the coworkers as part of our agency's conduct policy. You have a responsibility to help us in maintaining a culture of ethics here at work. We want to be a place that our clients want to be, that your coworkers want to be. We want to be a place that you want to come to every day. We have one of those jobs where if you tell people what you do as a behavior interventionist, they go, "Oh, bless your heart." You know why they say bless your heart? Because they can't do it. This job is tough. We have an ethical obligation to make sure that our job isn't tougher than it has to be. We do that as we avoid gossip, as we help one another, as we're working together as a team to better serve our clients and their families. It's important also that you report any form of abuse, maltreatment, any sort of fraud, or anything else that just doesn't feel right. Report it to your supervisor immediately. Below is also a copy of our grievance procedure. If you see something that is not right, report it immediately. 8.0 in the BACB Ethical Code talks about public statements, specifically that we have to avoid false or misleading statements. There are thousands of products and services out there that promise they can cure autism, that they can fix behavior in 20 days or less. We need to make sure that we are never those people making misleading statements. I know that ABA works. I've seen it work in literally hundreds of clients. Our services work. But we need to make sure that we are always truthful in the expectations that clients should have for us. We can never overpromise what we can deliver, and we need to make sure that we are very clear in what are the risks and benefits, what does services look like, and without ever giving anything beyond that. 9.0 talks about research. While we're not currently doing any research here at Journeys, we do have an ethical obligation that we're using the peer-reviewed research that's available to us. As a behavior interventionist here, you have access to the National Autism Center's National Standards Report that lists proven behavior interventions, that has the research available. If you have questions about what is the research behind this intervention, please go talk to your clinical supervisor and we can get you in contact with those research articles. And finally, number 10 talks about our responsibility to the BACB, to health and welfare, to family and children's services with these funding sources and regulatory sources that we serve. That means we're subject to their audits and accreditations, to their reviews, and to their plan approvals. We're subject to their direction, and we need to make sure that when anything that they're requesting or needing of us, that we provide it in an expedient manner. That concludes video 2. Stay tuned for video 3, where we're going to talk about what are the day-to-day implications and applications of these ethical guidelines.